You can say this for American capitalism. It is pretty ingenious. And if there's a dollar to be made in something, American capitalists will find a way to make it. That is particularly true for a little financial company called Bain Capital, founded and headed up for 15 years by Mitt Romney. What Bain does is raise tens of millions of dollars, invest into businesses, give some business advice, then sell their shares to the public at a profit, which can produce stunning returns to its investors. In other words, this is a company that became one of the top private equity firms today, and in the process, they help revolutionize American capitalism, which has been a boon for private equity and some of their shareholders, and often not so great for everyone else.
That Bain Capital acquired a company, in essence looted it, and then laid off 1,700 people. Now, if that's accurate, and if there are 3 or 4 or 5 examples like that, I think that's troubling. I think Governor Romney will have an ample opportunity to explain it, and I'm sure that this will probably end up, my guess is at some point you all may want to ask him to do a rather in-depth press conference explaining Bain Capital.
It was peak passive aggressiveness in the 2012 campaign from Newt Gingrich. Well, now comes news that Bain Capital, that same Bain Capital, is betting on a new profitable trend in American life they can make some money off of: substance abuse, particularly the increase in heroin use. According to the Substance Abuse and Mental Health Services Administration, number of heroin users increased by almost 180% between 2007 and 2012. A lot of this increase in use has been happening in the northeast part of the country, which is why Bain paid $58 million to acquire Habit OPCO Inc., the largest chain of substance treatment facilities in Massachusetts, along with CRC Health Corp., which Bain bought back for $723 million in 2006, and which just happens to be the biggest provider of methadone treatment in the country. In 2012, ran nearly 60 clinics in 15 states. Now, when I saw the headline for this story, I think the idea was that this was an outrage. I mean, is there no low to which predatory capitalism will not stoop? But then I read the story and I thought, well, people struggling with heroin addiction need treatment. We probably need more capacity to help them, so maybe this is in fact a capitalism success story in which the incentives for making a buck are also in line with helping people in need. Here to help me sort this out is Dr. Carl Hart, neuroscientist who specializes in studying the effects of drugs, associate professor at Columbia University, and author of the book High Price: A Neuroscientist's Journey of Self-Discovery that challenges everything you know about drugs and society. So what's your reaction to this news?
Well, I'm not surprised. I mean, like you point out, there's a buck to be made, and so that's what they do. That's their business. And the problem, or the concern that we all have, is that they may be cutting corners, and cutting corners being that they are not giving the patients the best care that they could receive. That's the major concern.
Right. So the concern is that you've got nonprofit clinics, and then you've got for-profit clinics.
That's right.
And it seemed conceivable that for-profit clinics could have all kind of perverse incentives, which is basically to get as many people as possible, to keep them on methadone as long as possible, presumably, because that's your profit base, and also maybe not to give them as much care or counseling as you would in a nonprofit when you're trying to basically get people in and out and give them the substance.
Well, Chris, you just laid it out. I don't know if you need me here to explain this because you just pointed it out. Another thing that you didn't say is that one of the things that's unique to methadone is that you usually have to come to the clinic every day to receive your dose. However, patients who are doing really well, they can sometimes get take-home doses. But when you now have this sort of for-profit motivation, now you have more people receiving take-home doses who probably did not earn those take-home doses. And then you increase the likelihood of those people maybe trading their methadone for something else or selling their methadone. So that's a concern.
Explain to me, walk through that again, because that's interesting. There's bills, I think, in 5 different states now looking to regulate essentially what this kind of black market supply that comes through the methadone clinics. Why would a for-profit center have more incentive to give people a take-home dose than a nonprofit center?
Well, that means that you don't have to see those patients on a daily basis, and so now you can cut back on your staff. You don't have to have as many people manning the office.
Right. So this is a less labor-intensive way of administering the drug than if you're in the business of keeping labor costs low and intake high.
Absolutely.
You might be incentivized to do that.
Yeah, I want to say something about those proposed bills. One of the things that concern me is that there are a number of methadone programs around the country that are doing it right. And so when you pass these legislations or these bills, you punish those people as well. it seems that we should go after the folks who are violating the rules, and rather than passing this broad, sweeping sort of bill. And so I'm concerned when we start to talk about passing legislation. Just deal with the problem as we identify the problem.
Is there a frontier in terms of heroin treatment, or is it something that we are getting better at as time goes on?
Emphatically, no. Unfortunately, obviously we are making some strides in research, but we're not that good in terms of drug treatment in general. There are a few programs, and they're usually associated with Research One or top-notch universities. But in general, most of the drug treatment programs out here are woefully inadequate.
Why are they woefully inadequate?
Ignorance. In part, there's so much ignorance in terms of what we think about drug addictions in general. So when we think about drug addiction, it's like, why are people addicted? Well, they're addicted for a variety of reasons, ranging from co-occurring psychiatric disorders to lack of skills, lack of alternatives. And so when you have these methadone programs, a major component is counseling. And that counseling is aimed to get at the bottom or the reasons for the addiction. And if you are not dealing with that, then you're not really providing treatment. It's
interesting, because what I'm hearing from you is a kind of analog to what a lot of people have said about the sort of trajectory of psychopharmacological drugs in psychiatry and psychology, which is the sort of reduction in the importance of talk therapy, right?
Yes.
And writing prescriptions to solve people's problems. And what I'm hearing from you is, look, folks that find themselves in this situation, there's probably a lot of stuff they need to work out. And working that out and working with them to work that out is got to be part of what the agenda is. And bringing it back to here, it's a little hard to see how a for-profit business that has big private equity owners to answer to is necessarily going to put in that extra muscle to make that happen.
Yeah, we already have a model of this in the prison industry. I mean, the private prison industry is exactly the same as this model. And so we know this. But the thing about the prison industry, we all are appalled by that. But when we see drug treatment, we think that people are doing good, or they have good intentions. But one of the things that this program, your program right now, is highlighting is that it's making transparent that treatment providers are not necessarily in it for the good of the patient.
Right. And that maybe that actually, in a weird way, is useful. Dr. Carl Hart from Columbia University. Always a pleasure, man. Thank you.
Good to see you.
All right, coming up, poor woman gets a job interview, has no daycare for 2 of her children. So what does she do? And how does the law react? That incredible story is next.